Good morning. Today is Wednesday, April the 1st, and welcome to our daily COVID-19 task force meeting. We're glad you're able to join us. We're going to start up here on the board. You know that this is day 15. This was originally thought to be the end of our self-isolation and social distancing, but as you no doubt are aware, the president and our National Institute of Health has pushed our 15-day self-quarantine to 30 days. And so that's when we anticipate that we may actually be beyond the curve and start to see some improvement across all of society. You also probably heard yesterday that the White House was throwing out numbers that they were anticipating a potential of maybe 200,000 people who will succumb to the virus. And what they're thinking about as they're looking at this and where that swell is coming on the curve right here is the number of people who have been ill or who are infected but have not been tested. So far, the United States has done more than 1 million tests, and we are testing at the rate of 100,000 a day. Those are really good numbers. They're better than any other place in the world. We're outperforming South Korea and China in Italy. And so as this increased testing continues, the curve is steepening, and it's not because people are getting ill. It's people who were ill are now being reported. And so there's an initial wave that is really making that curve jump up quickly, and that's what we're seeing. Let's go and look at the map. When we spoke last, this was 328. Here's the map for 330 right below it. You can see there's not a great deal of difference. It is filling in down here a bit, but the rest of the country is looking pretty good. New Orleans has not grown significantly. The city of Atlanta now is getting a little worse. Miami-Dade continues to be a problem, and we're watching Pinellas County, of course. Let's talk about some leading indicators. These are early examples that even though the numbers may be going up and we're anticipating a higher number of infected individuals across the country, there are some early signs, some leading indicators that are beginning to suggest that the curve is starting to flatten out. And here is probably the most significant one from my perspective. This is a graph of new cases on a daily basis. And you can see since the start, there have been 2 occasions where there was a day where the numbers went down, but we were not able to sustain that for any time. That has happened twice. I want you to come right over here to the end graphs. These are the number of new cases reported in the state of Florida for the last 3 days. And you can see for the very first time in well over a month, we've had 2 consecutive days where the numbers appear to be dropping. One of the other early indicators that is perhaps suggesting a flattening of the curve is it was taking the United States 2 days to double the number of cases. That has now been extended out to 6 days. We are growing at the rate of doubling the number of infected individuals every 6 days instead of every 2 days. The one other thing that is a positive sign is the number of reported individuals showing up at healthcare institutions, doctor's office, and hospitals with the fever. That is down significantly. They estimate about 30%. So the number of new infected individuals with fever presenting at hospital is beginning to decline. So there is some really good news coming out of this, and a potential that even though the severity of this is going to be far greater than we had originally thought, it does look like we are beginning to flatten the curve, and our 15 to 30 day quarantine is probably going to get us through this period and on to a much better place to be, where we've conquered the virus and have started to regain herd inoculation. Okay, we're back at the table here. We're going to go through the local numbers, give you an update as to where we stand there. In the state of Florida, there are now 6,741 cases with 85 deaths. So it went up about 14 overnight. Here in Pinellas County, we jumped from 129 to 167 over the last 2 days, and we are still at 5 deaths. So that is a really great number to have, because it means that our hospitals are handling the excess, and they have the capacity to address this, and people are getting the essential health care that they require. In Pasco County, we all need to figure out what Pasco County is doing. They jumped from 38 to 40, and they are consistent at 2 deaths. So they really seem to have a handle on this. And then in the United States, we're at 189,000 infected. That's up from 164,000 on Monday, and our total deaths have broken 4,000. Restrictions are still in place for Hillsborough and Pinellas County, but not throughout the entire state. The governor has not yet made that decision. We only have 1 staff member under quarantine. We do not know the results of that. We're waiting on testing. We have no residents or employees who are showing flu symptoms that have reported, and we've still 0 residents and 0 associates who have tested positive for COVID-19. So those are our daily numbers, and we're going to roll over to Jesse with an update for housekeeping. Jesse.
Thank you, Brent. Hello, everyone. Jesse Rosalie, your housekeeping director. Just wanted to give you some updates on what we're going to start doing effective tomorrow, Thursday. We are moving on from commodes, so we will no longer start cleaning commodes until further notice, and we will now focus on the flooring. So anything that has to do with vacuuming your carpet and mopping your floors, that's what we'll be starting to do tomorrow, Thursday, all the way until further notice next Thursday. Sheets and towels will still be replenished for you, and we'll continue to change those for you as well. I want to talk a little bit more about toilet paper. So right over here you have the standard roll of toilet paper that we usually buy for our homes, and we have the toilet paper that we currently use in our common areas. Our toilet paper right over here, it's probably double the size, so it's about 850 count, 2-ply, and this one right over here is about 350, 2-ply as well. So as you can see, the ones we're providing right now to you at small price, it's the one to your right hand side over here. I will ask to please give me a call directly at extension 508 if you want me to coordinate the delivery of these items for you. They will be available Monday through Friday. Now I do ask that you give us a call on Friday. Cutoff time is 1 p.m. so we can deliver on Saturday. So any calls I receive, I will deliver these items the next day to your doors. If you have any questions, feel free to give me a call directly, and thank you all for your patience.
Thank you, Jesse. Appreciate that. Next up is Leslie. What's your update for today, please?
Hi. So as a best practice at Regency Oaks, we will be doing daily wellness visits for our new move-ins for the first 14 days, as well as recommending that they do a self-quarantine. We're asking this of our new residents as well as the wellness visits because we want to make sure that they understand the communication when it comes to health services here, And the next step, if they're receiving any symptoms from the virus, we want to make sure that we're in great communication with them. Furthermore, Diana Toscano, the wellness nurse, will be doing wellness visits during the food deliveries. So you'll be seeing her occasionally during meal deliveries. This is just to help us monitor the residents, see if they are experiencing any symptoms. So again, you'll be seeing her occasionally throughout your meal deliveries.
All right, thank you very much, Leslie. And we're now going to go out in the field and take you once again behind the scenes and share with you some of the exciting things that are going on here across the campus. All right, we're in the back of the north building, and we're going to go out in search of George. You know, we are very proud of the fact that not a single associate has lost their job, been laid off, or even had their hours reduced. We're finding a lot of things for them to do, and it's all benefiting our residents. Let's go find George. We've caught up here with George, our maintenance supervisor, and George, we were interested in seeing sort of what are some of the projects that you have the crew working on.
All right, so what we've got, two guys outside, they're pressure washing the carports. We're getting rid of the spiders, cobwebs, and wasps out of the parking spots. We've got the front of the north already done. We're in the back of the north starting this morning.
So is that done?
No, these aren't done yet.
All right, so
This is
just
what you'll
do-
see every morning here at Regency Oaks. Empty parking spots, this is what we're going to be pressure washing this morning. You'll see the north's trash room has been painted. We updated the gray and the white, and we're going to go into the service area, which is an area that everybody has been complaining about. You'll see a nice shiny room. So we took the gray off the doors from the trash room. We brought it all the way into the area. It looks brighter, shinier, and cleaner. The only thing left is we're going to touch up the green and the blue for the recycling in the room. And that you can see all the way around to the elevator that it's complete.
That's
Good morning, Regency Oaks. We just wanted to remind everyone that we will be doing our sweet treats, our midweek pick-me-up. We're going to have all of the directors stopping by, saying hello, getting some nice FaceTime with everyone. So we look forward to seeing you at 11:30.
Okay, I hope you enjoyed getting to look behind the scenes at some of the things happening here at Regency Oaks. Have a safe day, and we'll be back with you on Friday for our last report of the week.